Sam was my brother, and he was my only brother.
He was out, this was him. I mean, this portrays him to the T. I mean, you never saw him mad. You know, I mean, well, maybe Ida may have, but we never did. It's like, you know, he was always the center of attention.
I just can't think of him being gone.
You know, it's your loved one that's laying in that bed. And even when we know that the outcome is going to be not a favorable one, we still should be including the family, even up to death.
When I got here, I kind of knew, you know, I'm like, the outcome wasn't going to be good. So he was an organ donor, so that we kind of had a little bit of hope that we were going to be able to do, you know, honor what he had wanted.
He was an organ donor, and so they were very accepting of that and really wanted to have that wish fulfilled.
They were trying very hard to grant that wish for that patient, but it got to the point where they knew that they were not going to be able to continue what they needed to do to keep his organs viable. And at that point, the family did not want to be put through a whole code and a whole stress of what that would do.
And I remember, I'm like, all of this is for nothing, all of our hard work. You know, being a nurse, we try our best to do what we can do every single day to, you know, get the patients better, at least, you know, to get him to that point where we could do the good organ harvest, but it was not looking good.
You had to step and be the patient advocate instead of trying to just save the patient in order to harvest the organs.
Celeste actually stepped in for us to talk to the organ tissue nurses that were there, because they were like, well, we're honoring Sam's last wish. And it's just like, no, we are. We know Sam. We know what he would have wanted, you know, and it's just like, and it's not to this extent.
And ultimately, that's what she did. And it provided closure and comfort to that family, even though they lost their loved one.
Whenever we finally they took off all them, started taking off the medications, I had asked Celeste, I just want to lay down with Sam one last time. And I didn't hear Ida ask Celeste this, you know, and I was just like, because we were, you know, it was just a lot of stuff. And then the next thing I knew, Celeste made us all leave. I'm like, why is she making us leave? You know, I'm like, she hasn't made us leave before. And then I saw what she did. And I was just like, now I know, you know, and I'm like, and that's the last thing that Ida wanted, you know. And I think to allow that, for that closure part of it, was just that wow factor that we talk about, to make it, nothing was going to make us feel better. Nothing was going to take away the pain, but to allow that last request, I think that's what really, you know, I'm never going to forget her, you know, never. So it's just like, I see nurses, we've had lots of family members in the hospital, we've had lots of good nurses, but we've never had a nurse like Celeste.
It was a way for her to just connect with him one last time, and I felt that was extremely important for her comfort.
What a absolutely great moment, lasting impression, and just loving gesture that she made for that wife. They will never forget that.
You're usually, when you come to the ICU at the most critical time in your life, and to me, you need some kind and compassionate care when you're here.
Probably won't remember Celeste if I see her walking down the street, but I'm never going to forget what she did for us. I'm never going to forget her name.
It renews my faith in the human race to know that as many bad things are going on in the world, there's still wonderful people out there, and we've got them right here at Medical City.